Hey guys, welcome back to another episode of A Talk with Your Doc. I'm Dr. Jeff Teeter with Titan Health Direct Primary Care, and we've got a special guest speaker coming to talk to you about eye care. Let's jump right into it. I'm excited for this episode. Hey everybody, thanks for joining us. I've got Dr. Lewis here with Capital Eye Care in Jefferson City, Missouri, and he's going to talk to us a little bit about eye care, educate us on different things that he does in the office, and I just want to say thank you for coming and doing this with me.
Thank you for inviting me. I appreciate it.
You bet. So let's jump right into it. Just tell me a little bit about your practice. You do a broad scope of things there, but give me a little tidbit and our viewers a tidbit about your office and what you do.
We're primarily a medical and surgical office that takes care of people with medical and surgical ophthalmologic diseases. Everything to do with the eye and the lids and the areas around the eye. We've been there for 29 years now. There's 3 of us partners. We have 2 more joining us, and we're all MDs. And basically, we cover all the major eye diseases that people come across.
Well, let's jump right into what you do at your office. Just a couple of things you do there. One of the things I want to talk about is LASIK surgery, and you have a bladeless LASIK machine that you utilize. And can you tell people who's a good candidate for LASIK surgery? What's the safety of it, and what are the outcomes that you've experienced in your clinic with using LASIK?
Wonderful. Yeah. So people come in, and anybody that's wearing glasses or contacts that would like to get out of them, would be interested in LASIK at some point, simply because it's just nice to be able to see without glasses and contacts. And we put them through a simple evaluation that requires some fairly sophisticated measuring devices that can tell us the parameters that we need to determine whether they're candidates or not. LASIK involves reshaping the cornea, which is a very static tissue. It doesn't change throughout your life very much, and so if you reshape it, it's going to be a new shape, and now you can see at a different point, hopefully without your glasses. And the depth of the cornea and the condition of the cornea are critical to being a good candidate. We've been doing LASIK since it was first available in February of '95. I had about a dozen patients waiting for the approval. And so we've been through 5 machines in the last 25 years, 5 different lasers, and these things are over $500,000 a piece. They're incredibly sophisticated, but about in that time frame there's been significant advancements, and our most recent advancement has been it's been the most legendary advancement that we've had of all 5. And it can now reshape the eye with lasers that fire pulses at 2,000 times per second. They track your eye movement, so if you move just a little bit, it'll move with your eye 2,000 times per second. It's remarkable. And most of our treatments when we first started took anywhere from maybe 45 seconds to a minute and a half. Now an average treatment is between 5 and 12 seconds.
5 and 12 seconds.
It's amazing.
Now, what are the outcomes that you've experienced as far as vision and any complications or blindness? People always worry about it.
Critical. And people wait years to have LASIK because of concerns about what can go wrong with my otherwise healthy eyes. So in the years we've done this, we've done somewhere north of 15,000 eyes. We've never had an infection, never had anybody lose vision. And
no infections, no vision loss.
0, right. Wow. And we test both lasers before each and every eye we do. So if somebody comes in, we're doing both eyes. Both lasers get tested before each eye that we do. And if it doesn't pass the test that we put them through, we don't do surgery. We cherry pick people. We want people to be good candidates for LASIK. So we don't do people that aren't good candidates. 96% of our patients are 20/20 or better after their LASIK without their glasses at the depth that we want them to be, because some people we choose distance and near with the opposite eye, and the 4% that aren't, we can almost always tell them ahead of time, hey, you've got some unusual condition or unusual treatment that we're going to do that this isn't going to allow you to see 20/20, and those patients understand that ahead of time.
So interesting that you mentioned that. You can do the same thing with LASIK surgery as with the cataract surgery. You were describing to me that you can get near and far-sighted vision all in the same surgical procedure for cataract surgery. So you can do that with LASIK as well?
Right. So anybody in their late 40s and on up is not going to have as much depth of focus. And if we correct both eyes for a distance, they're going to need reading glasses.
Right. And
so the one option is, as you alluded to, this monovision, where we do their dominant eye for distance and leave the other eye just a little bit nearsighted so they can see kind of at a computer, a desktop, a dashboard, and see distance without glasses, and not have to have reading glasses on every time they want to answer their cell phone. And a majority of probably 70–80% of our patients choose that. The few that don't, there are people that need perfect distance vision: pilots, bus drivers, truck drivers, heavy equipment operators, they need both eyes for distance and they don't mind wearing reading glasses.
What's the difference between cataract surgery and LASIK other than one's just to correct vision and the other one is to correct
The cataract.
the cataract?
So when light comes into the front of the eye, 3/4 of the bending power of light rays, so that light is focused on the retina, happens at the cornea, but the other quarter happens at the lens. So both at the cornea and the level of the lens, we can vastly change the power of your eye. Now in younger patients, you don't want to remove a clear lens that can still focus, so we work on the cornea.
Sure.
But later in your, and this is, you know, somewhere in your middle to later 50s and on up from there, if people have enough of a cloudiness in the lens, and that's what a cataract is, rather than do LASIK and allow their lens to keep getting cloudier over time, we wait until that's far enough along that it's worth removing the cataract. We remove the cataract, put a new lens in there, and we can make that lens any power we want.
Interesting. So we'll just shift gears slightly and start talking about glaucoma treatment. So first off, what is glaucoma and what are the symptoms associated with glaucoma?
Glaucoma is an amazingly common condition that gets more common as we get older, and basically it's a combination of elevated pressure in the eye that slowly damages the optic nerve. The sheath of the eye, the white part of the eye, the sclera and the cornea are very tough tissues, but the optic nerve that goes in the back is very soft. And so as the pressure elevates over time, it starts to damage the optic nerve, and any vision you lose from that damaged optic nerve you can never get back. So we always check the pressure in people's eyes when they come in for every visit. Just like you would check somebody's blood pressure, we check the eye pressure.
How often should people go and get an eye exam to check for this and any other pathologies?
Yeah, for glaucoma and for just general regular eye exams, we start to worry after the age of 40. From 40 to 60, we recommend every 2 to 5 years. Believe it or not, that's actually plenty of time to pick up on something like this.
Okay.
From 60 to 70, we recommend every 2 to 3 years. And from 70 on up, it's every 1 to 2 years.
And now glaucoma, can you tell that it's coming on?
You can't. It's a silent condition. People can't tell that their pressure is elevated in their eye until typically it's beyond double the normal pressure. So we recommend people get them checked. And the only way to check for glaucoma is not just the pressure. You have to look at the optic nerve too.
Right.
So if you go somewhere and somebody checks your pressure in the mall, it's great to know your pressure's fine. Doesn't mean you don't have glaucoma, because about 1/3 of my elderly patients actually have glaucoma and their pressure's in the normal range.
So that's why it's important to go get your regular eye exams, because you may not know that it's happening until it's big time there.
Absolutely.
Okay. Macular degeneration. That's another one that I'd like you to just kind of talk briefly about. What are the risk factors in developing it and what do you do to treat it?
You know, the risk factors for developing macular degeneration are two very simple risk factors. It's really age and race. It doesn't occur in African American populations. It's very common in the Northern Europeans with fair skin and lighter colored eyes, and then it kind of gradually becomes less common as the skin gets darker. And it doesn't happen in kids and typical adults. It happens in folks starting typically in their 60s and on up from there.
Okay. And then treatment options if it goes to wet macular degeneration.
Well, there's two major categories. Everybody starts out with the dry degeneration, which is literally just a deterioration of the pigment in the back of the eye, right around your central vision. It's the most active part of our eye. It's where all the cones sit that we see colors with. And it's just so active that this pigment slowly just gets taxed, and it starts to deteriorate over time. Just like our skin pigment starts to get mottled, the back of the eye, the pigment starts to get mottled. And as it does, the photoreceptors that are supported by that pigment begin to deteriorate. And that's when your vision starts to get worse. And we treat that, we slow it down by having people take it's a mixture of vitamins. It's ACE, zinc, selenium, and lutein. A study done many years ago showed that those vitamins, those patients who took vitamins over 15 years ended up with 25% better vision than those that didn't take the vitamins. And when I tell that to people, hey, in 15 years your vision will be 25% better if you take a little vitamin once a day, they take the vitamins. It's just hands down good scientific evidence, a good place to actually take vitamins for a specific reason. A small percentage of those patients, 10, 20%, depending on the patient populations, that pigment deteriorates enough that little defects happen in the pigment and blood vessels grow through those defects and get underneath the retina where they shouldn't be. That deteriorated pigment's not nourishing the photoreceptors as well as it should, so there's a need for oxygen and nutrients and glucose. And once these blood vessels get under there, they grow in there almost like a healing response. They grow between the photoreceptors that we see with. They're all parallel, they hang underneath the retina. And these blood vessels grow in there, they disrupt those photoreceptors, and that blurs your vision. And people start to notice a spot in their vision, or some distortion or waviness. And those symptoms are critical that patients get in to see us as soon as possible, because we now have treatment. We do injections in the eye for a medication that actually can remove the stimulus that causes those blood vessels to grow. And if you remove that little protein, these blood vessels just shrivel up, it stops. 85% of patients will stabilize or improve if they get the treatment. The sad thing is if they don't get the treatment, 85% will typically get worse.
Okay. So let's move on to diabetic eye care. The treatment of diabetes is something near and dear to me. And there are a couple of complications that can happen with untreated diabetes, and one of them is diabetic retinopathy. And so what are good things you can do to prevent it, which we'll talk about with general diabetes care, and other than that, what happens in the eye if you don't take care of it and you let your diabetes run willy-nilly?
So the thing we tell all our patients with diabetes is just watch your blood sugar and your blood pressure. And obviously blood sugar is a very difficult issue with diabetics, and you can speak to that at length. But blood pressure is critical. And we find that actually our patients that are diabetics that have reasonable blood sugar and terrible blood pressure actually tend to do worse with their eyes than those who have terrible blood sugars but really good blood pressure.
Really?
Both damage blood vessels, and that's what diabetes does. It damages the tiny blood vessels really in the back of the eye. And as you know, as blood sugar fluctuates up and down, it damages the cells that line blood vessels, and those cells begin to deteriorate and blood starts to leak out of those blood vessels, fluid leaks out of the blood vessels, protein collects in the retina, those blood vessels get swollen and they close off, and so they lose blood supply to certain parts of the retina. And so we see a variety of different things in the back of the eye, and we can see many of this long before it affects your vision. So that's why Medicare and really the American Diabetes Association is recommending that patients with diabetes get their eyes checked every year. You want to know about this stuff ahead of time.
Right.
And a fair number of my patients, or our diabetic patients in general, get treated for their diabetic retinopathy before they even notice a change in their vision.
And this is one of the leading causes of blindness in the U.S., is it not?
It is.
Okay.
It is, absolutely.
And so is macular
It's
degeneration.
number one.
That's number one.
Right,
Okay.
right.
Okay.
And so the nice thing about diabetes is it's very treatable. It's interesting, the same treatment I was talking about, these injections for macular degeneration, we do those for diabetes as well.
So that's if you get to it's called proliferative diabetic retinopathy, is that correct?
Exactly.
And so if you go too far, there are treatments.
When the retinopathy gets much more severe and you start to lose vision, you get some bleeding inside the eye, and people's vision gets worse. It's often associated with some abnormal blood vessel growth. Well, just as we can stop the blood vessels with the macular degeneration, that same repertoire of medicines can actually stop the blood vessel growth with diabetes. And then, of course, when they're getting eye injections, it's a great time for us to have a conversation about their blood pressure.
And so you do a lot of education on general medical topics as well, in addition to things outside of just the eye, while you're in the office with them.
Oh, absolutely. You know, we're all physicians, and we all go through our general training together, and so we know how critical that is. So yeah, we always have conversations with all my patients about, you know, how their general health is, and are doing the right things in their lifestyle to help keep this from getting worse.
Yeah. And just like I tell my patients, it's teamwork. I'm working with you to help your disease, and the specialists are working with us to help take care of your disease process as well. It's good to know that you do a lot of that.
Well, it's great for patients to hear that support between their doctors, because at my end, it's much easier to say, you're going to lose vision. Now's a prime time for you to really take a good look at your lifestyle.
Right.
You have a tougher job. You get patients who are feeling pretty good. They just need your help to maintain and keep out of trouble too much. But if they lose vision, that's a great time to make a life change.
I catch them before when I say, if you don't, this will happen, and then you catch them when I said, it happened,
It's happening.
here you go. All right, well, wonderful. Thank you so much for agreeing to come here and speak about these things with us together, and tell us a little bit about your clinic. I really appreciate it.
Enjoyed it, Dr. Jeter. Thank you very much.
Thank you. Well, that wraps up another episode of A Talk with Your Doc. I'm Dr. Jeff Teeter with Titan Health Direct Primary Care. Feel free to visit my website or come in and just talk to me in person. We were just speaking with Dr. Lewis with Capital Eye Care here in Jefferson City, Missouri, and I've got all of his information listed right here. Visit his website, give them a call. They'd love to help you. Thanks again, everybody, and I look forward to seeing you next time. Bye.